All right, everyone. So today we're talking about don't miss a beat, your path to a healthier heart. And so this is a topic that I love to discuss with folks just because there's so many things that we think we know about the heart, that we think we know about healthy living and heart health. But there's also some myths and there's some things that this class really kind of talks about in detail that other people don't touch on. And so the passion project for me, cardiovascular health, is always something that my family in particular has struggled with. And so personally and professionally, heart health is something that I feel very passionate about. So one of my favorite talks. With that being said, my name is Abby Horton, and I'm a registered nurse. I teach here at the University of Alabama in the Capstone College of Nursing. I'm a certified health and life coach, a wellbeing ambassador for the Honors College, and your wellness class educator. I have my contact information listed here. It's abby.horton@ua.edu. And if y'all have any questions or want to reach out, please feel free to do so. So we have some upcoming events we'd like for you to know about: health screenings, wellness classes, and programs. Y'all are welcome to take a quick screenshot of this. We also have a newsletter. So if y'all haven't signed up for the newsletter, you can go to wellness.ua.edu and you can get our archived webinars and all of the wonderful updates that wellness and work life offer. And we have Miranda on the call today. She is one of the team of three that makes all of this happen, sometimes even just behind the scenes. And so we're really, really grateful for that. Miranda will pop the slides into the chat at some point, probably toward the end of the session today, just so that y'all can grab those and download them. If for some reason you're on your phone and you can't get to those, just let us know and we can send those to you. So please do check out those health screenings. You can get up to $100 in gift cards when you complete all three. So the health screening, the wellness class, and the program. And it's part of your benefit as a UA employee. So we'll hope you'll take advantage of that. All right. So the disclaimer for today is that this presentation is just for educational purposes only, and it doesn't constitute medical advice. And so if you do have specific questions or health concerns, we want to encourage you to contact your healthcare provider and to ask those questions so that you can get really personalized and individualized feedback. But we will take general questions about heart health at the very end. So we hope that you'll be able to identify some healthy habits related to reducing cardiovascular risk after you complete the class today, that you understand the relationship between cholesterol and hypertension, and you learn the risk factors for both, and that you're able to identify some healthy habits to reduce your high cholesterol and high blood pressure and to really improve your overall cardiovascular health. So cardiovascular disease is the #1 killer in the US. And we often talk about the risk factors as being, high cholesterol and hypertension, but we also have lifestyle, behaviors like an unhealthy diet or being overweight or obese, even things like air pollution, which is a lot harder for us to control, tobacco use, use of alcohol beyond the recommended daily servings, physical inactivity, and even things like diabetes and kidney disease, which we often don't think about. And so at the heart of all of that, we have this, underlying inflammation that can sometimes occur because we are introducing ourselves to all of these, lifestyle behaviors and then other diseases that also cause inflammation. And so if you look at the risk factors for CVD or cardiovascular disease on the bottom right of this graphic, all of those are related because of the inflammation piece. And so what we're learning is that inflammation is really one of the, I won't say root causes, but it's one of the first indicators that you're having issues with chronic health conditions or chronic disease. And underlying the inflammation, there is probably an underlying issue, whether it's a toxin or an exposure or it's a lifestyle behavior. Those are really the root causes, but inflammation is going to be that key factor that relates all of those factors, risk factors together. And so we want to think about how we can really reduce our individual risk factors and how we can help educate others. So you see at the bottom left, you have global causes of death, and you can see that cardiovascular disease is 18.6 million, whereas you have cancer at 10 million. And we hear much more, a lot of times, about cancer Then we do cardiovascular disease. It gets more attention and it gets more funding. But cardiovascular disease is really what we see people who are admitted to the hospital most often, people who access the healthcare system most often. It's because of cardiovascular disease. And part of that conversation is what we call metabolic syndrome, where you have an increase in your overweight or obesity status. You've got high cholesterol, high blood pressure. You oftentimes have diabetes. All of those things together is called metabolic disease. And that is what you will see when you think about heart attacks and stroke, and all of the other challenges that you have with chronic health disease, even things like Alzheimer's. People are calling Alzheimer's diabetes type 3 now because of the risk factors related to blood sugar and inflammation. And so we want to think about how we can control for those. And so heart disease and stroke cause the death of 1 in 3 women every year. And when we do talk about cardiovascular disease, we often think about it as being a predominantly male issue. And we know that women are impacted, but they're impacted differently. And so when men have, things like stroke or heart attack, they have very characteristic signs and symptoms that are often seen and often talked about in campaigns or news media or public service announcements around those things. Or, if we have Heart Health Month in February, we hear a lot of the traditional, disease factors and the, signs and symptoms of a heart attack or stroke, but sometimes that looks different for women. And so women tend to have more of a genetic predisposition. They also tend to have different signs and symptoms of early signs of stroke or heart attack. So for men, we think about, grabbing the left shoulder and having left shoulder pain, and having a pressing, elephant-like feeling sitting on their chest, and they feel short of breath. Whereas women may have more of like GI disturbance. They may have more of like a gallbladder, radiating pain in their chest and in their back. They may not have the stereotypical left shoulder pain that men tend to present with. They often can feel short of breath, but they may not have that huge pressing feeling on their chest like men often will relay. And so there are just some differences there that we want to be mindful of so that we don't miss the signs and symptoms of the early signs of heart attack. And for my mom personally, she had early onset heart disease, which is characterized as being in your early 50s. That's early onset for women. They do this by gender, and we know that gender really, it's more about hormones. And so while we'll talk about male and female, just know that we're really talking about the lifestyle behaviors associated with genders and with the hormonal health that's impacted. And so just want to preface that. So with my mom and her early onset, she did not have the stereotypical pain. She actually thought that she was having an issue with her gallbladder because her symptoms were much more that of a gallbladder attack. And so that's what they were screening for her for early on. And thankfully, they were able to catch that it was actually a heart attack, that she had 2 blockages, and she ended up actually going to the cath lab and having to go with the second blockage and have open heart surgery. And she, initially said, oh, I'm just having some stomach pains and feeling like I'm having a gallbladder attack, which she had before. This is not anything I need to go to the ER for. And thankfully, there were other people with her when she was having her heart attack, and they said, no, you're obviously very sick. Whatever's wrong, you need to go. And so I think sometimes we can dismiss symptoms as being more benign than they are. And so hopefully that story will resonate with you, and you'll remember that when you're thinking about your own health or those of your loved ones, to never dismiss something. When you're obviously sick, you need to seek help. So cardiovascular health is really not just about the heart, it's about the heart and the blood vessels. And so when you think about your risk factors and the development of cardiovascular disease, it really is this relationship between high blood pressure, high cholesterol, tobacco use, diabetes, and then your risk factors of being overweight or obese. And that will certainly increase it. Again, because of inflammation, and also we know that abdominal fat in the the torso, in the core area, having adipose tissue or fat tissue around our vital organs. So when we carry our weight, we used to say, the apple shape. When you have that excess abdominal fat and excess adipose tissue in the core surrounding your heart and your lungs and your liver and your pancreas and your spleen and all of those, vital organs there, you have more of a risk factor for chronic health disease because that fat then is surrounding those tissues. And so someone who carries their weight in their middle section is going to be more at risk than those who may be overweight or obese who carry that weight in their limbs or in their hip area. And so that's important to know. I personally am an apple shape. So when I have extra weight, I tend to have it in my middle. And so I have to be more concerned about that. And anytime I talk about, overweight or obesity, we look at the BMI chart to determine that. And I just want to say that the BMI is a good, metric for you to reference, but it's not the end all be all. It's really not the gold standard. When we think about it, really waist circumference tells you more. And so if you measure your waist circumference and you notice that it's over the parameters for someone of your height, your gender, etc., that can tell you a little bit more than even BMI. So BMI is just one of about 5 to 6 metrics that we look at, but BMI is what we hear the most about. And there are some flaws with the BMI system because it was based on, mostly European Caucasian males about 150 to 200 years ago. And so there are some inherent flaws with that, but it's just one of about 5 to 6 metrics that we can look at and that we know that there is some evidence that there could be risk factors or concerns. And so I just want to preface that I personally have been on a health and wellness journey for the last 3 or so years, and I've lost about 70 pounds or so. And so I know that talking about weight can be very triggering for some people. And it can be hard when you feel like you're trying to lose weight and it's not happening for you. So we've got some good programming coming out, hopefully in the spring, that talks about how to lose weight well and how to do it in a healthy way. And we'll talk about some of those principles today. So creating awareness, we have the Go Red for women. They have this campaign that's really targeted at females because we know that they're at risk and we don't talk about their specific risk factors nearly enough. And so the February campaign is usually by the American Heart Association, the Go Red month. And so many people don't know, though, that Go Red is actually an acronym. And so it means to get your numbers, own your lifestyle, realize your risk, educate others, and don't be silent. And so getting your numbers, we said that a lot in the health and wellness sphere. And one way to do that is by going to these free health screenings that Wellbeing offers so that you know what your blood pressure, your cholesterol, your LDL, your triglycerides, that you know what your weight is and your height. Because our height can change as we age. We can lose some height. You've got to own your lifestyle, meaning that the things that you can control, you need to try to control those. And so if that means that you evaluate your alcohol use, or you evaluate your tobacco use, or you reduce your stress, which is often something that we all need to do, myself included, my hand is raised. If we need to work on a healthier weight, if we need to work on healthier lifestyle choices in terms of food or movement, exercise. Exercise does not have to be a fancy HIIT workout, or it doesn't have to be an Orange Theory class or CrossFit or anything like that. It could simply be going for a walk 1 to 2 times a day to get 15 to 30 minutes of exercise in, for about 30 minutes to 45 minutes, 4 to 5 times a week. It could simply be that walk after dinner, or the walk in the morning when you're taking your dog out or something. It doesn't have to be this super expensive and super unattainable workout that you do every day for an hour of your day, because that's often setting ourselves up for failure. So manage your lifestyle and really own that. Have some accountability around that. Realize your risk factors. So each of us have individualized risk factors. Part of that can be identified through the Wellbeing screenings. The other part could be with your primary care provider, so that you know exactly what you're at risk for and what you can control and what you just need to be aware of. You can educate others. So oftentimes, genetics plays a role. So educating your family members who may also share some of your risk factors, but also educating your friends and your family, that's important. And then don't be silent. So when you know that you, are working on something, it's often easier to do it with a friend or someone that you can have some accountability with. but also don't be silent in the sense that when you do have symptoms, like my mom, she was very silent. She laid down on a flat surface and said, I just need to close my eyes. I'm okay. I don't need anything, because she didn't want to be a bother to anyone. And thankfully, her best friend saw her and was like, no, something is wrong. We need to take you. And she drove her to the hospital. And so don't be silent in the sense of when you do have symptoms, ask for help. There's no reason to not. And if it turns out that it is just, reflux, which some women, often think it's just reflux or GI disturbance, or if it is just your gallbladder, then that's okay. That's great, because then you're getting help for those things. So this is the Go Red for Women declaration, and it talks about the reasons that we go red for women and how it can make a difference between life and death. And certainly we know that that's true. When we know better, we do better, as Maya Angelou says. And so it's often a part of our story is realizing that, it's not just a male disease or condition, and it's not just something that older people face. We certainly know that there are a lot of risk factors for young folks. And we need to be more, conversational about sharing this kind of information with our friends and family. So my favorite part is talking about cholesterol, because we often vilify cholesterol and say that cholesterol is bad. And so in health and wellness, we in healthcare in general, we hear about this is good, this is bad. And we really moralize, food and behaviors of saying, oh, well, good job for eating this, that's not good for you to eat that. And what that does to us is it makes this dichotomy of this is off limits, but this is okay and this is good. And the thing is that we oftentimes are eating foods that may be considered healthy, but maybe they're not healthy for us. An example of this is like cruciferous vegetables. So you've got, broccoli and cauliflower. Well, if you have diverticulitis or you have Crohn's disease, those are two vegetables. Cauliflower is definitely having a moment right now. Or broccoli, those are healthy foods, but they're not healthy foods for someone who has GI issues or who has diverticulitis or Crohn's disease. And so while something may be considered healthy, it may not be healthy for you. And that's just one example. And so the same thing with cholesterol. Cholesterol often gets vilified or seen as bad, that we want to get rid of cholesterol, when actually we need cholesterol. Our liver makes the majority of the cholesterol that we have in our bodies, but we really only talk about the fact that we have cholesterol from foods. And so it's so important that when we think about lowering our cholesterol, it's not just about the foods that we consume, but it's also about our liver being responsive and producing it on its own. And so that's an important part of the conversation that I want us to really touch on today. Cholesterol actually is more present when we have inflammation on board. So going back to what we talked about, where inflammation is really kind of one of the main things that we see interconnect a lot of chronic health diseases, inflammation is going to be kind of a red flag to say, hey, there's a problem going on. We need some help over here. And the cholesterol is the helper that comes, because cholesterol is actually the Band-Aid that will patch the different places that inflammation has caused injury to. So for example, in your blood vessels, when you think about your arteries and your veins, we'll talk about arteries. So when that blood is flowing through and we've had some inflammation that indicates there's a problem in that blood vessel, maybe it's that inflammation has caused an issue, or maybe that there's some damage there because of, we're eating sticky sweet foods, and we've got high blood sugar, high blood pressure. So we're really putting a lot of pressure on that vessel. Think about a hose out in your yard that gets a lot of rust in it, and the pressure builds up until the pipe bursts. That's what happens to our vessels sometimes. And so the cholesterol gets signaled by the inflammation, that inflammatory response happens. And then we have a lot of different helpers that come, things like, helper T cells, and, you've got different parts of a white blood cell that come to alert that there's a problem. And then what happens is the cholesterol gets signaled. It's like, oh, I need to go help that situation out. And the cholesterol goes and it goes to patch the vessel. So it's kind of like the glue or the putty. It's very sticky. It helps to make sure that gets really, good protection so that it doesn't burst open. But what can happen is if that inflammatory response never gets signaled to go off and to stop, then cholesterol keeps going to that site and it can build up. And so that's represented here in this little yellow part of the vessel. And so what happens then is it builds up and it constricts or narrows the amount of blood flow that can go through. And so you see there, by the time you get to this third image, instead of it being open like it is here, you've got a lot of cholesterol deposits that you have to be able to get the blood through. So the blood pressure goes up in response because it needs more force to get through that small opening. And I think if we explained cholesterol in that way to everyone starting, in K through 12, how your body works, it's really amazing. And I get excited about it because it means that cholesterol and inflammation are supposed to be there to help you out. We are wanting that system to work properly because then if it is, you're getting the help that you need. It's only when we're continuing to have inflammatory things like tobacco use and alcohol, and when we're continuing to eat highly processed foods, that we keep sending that inflammatory response into motion and we keep sending cholesterol to places that we may or may not need it. And it's not just about all of the cholesterol that we consume, it's about our liver also is getting that response to make more cholesterol. And so if you're reducing your cholesterol that you're intaking by, consuming food and you're still not getting anywhere with the numbers improving, it's because you still have inflammation and that inflammation is still telling the liver, hey, keep making that cholesterol, we need you. So there's a lot of good details on this slide, and y'all can tell how passionate I get about this because oftentimes when we take a cholesterol lowering medication like a statin, or we do something about our diet and we go to our healthcare provider and they're like, well, your cholesterol still hasn't budged. We need to do something different with your meds, or are you really taking your medication? That can feel very invalidating to us or disappointing when we're doing everything that we know to do. Well, now kind of the behind the scenes is that there's still inflammation on board. So you need to work to also reduce and lower your inflammation to be able to help your liver out. So I hope y'all are excited about that. I am so excited to share that because it makes a huge difference in how we view ourselves and how we view the effort that we're putting in. So in nursing school, we learn, and I think medical school everywhere, dietitians learn this too, is that the LDL is the bad cholesterol and the HDL is the good cholesterol. And so we were always taught LDL means lousy, it's the bad cholesterol, and HDL, the H is healthy, that's the good. And then we've got the red blood cell. But what I want to say to y'all again is that cholesterol isn't bad, it's needed. We couldn't really survive without it. It's naturally made in our bodies by the liver and it's in the foods that we eat. And every cell in our body requires cholesterol because it's one of the building blocks for our hormones. And so it helps build vitamin D production. So if we're taking medications or doing things to lower our cholesterol, sometimes one of the unhappy effects of that is that we're also disrupting other hormonal or vitamin processes in our body, like vitamin D production and synthesis. And so it's super important that we understand the combination of those things and the relationship they have with our overall health. And so, again, if you want to look closer at this, there are many studies that you can go and see, like on an NIH level, looking at the grants and the research that's done that supports this. And so definitely do your own research. Cholesterol is mainly composed of fat and lipoproteins, and the lipoproteins is comprised of cholesterol, protein, and fat, which we know as triglycerides. And so oftentimes we talk about triglycerides, but we don't say that triglycerides are actually fats. And so that's why when your triglycerides are high, a lot of people are like, oh, you're eating too much fat. And we're going to talk a little bit more about that. So what is cholesterol and where is it created? Cholesterol is going to be a waxy substance. And remember, I told y'all it's sticky. It's often soft and it can feel like fat or adipose tissue. And we usually see this in the bloodstream and in the cells themselves. Cholesterol is normal. It's a healthy aspect of your health. Like I've said, it is in your liver being made. About 75% of cholesterol is made there. And then things like meat and dairy products and other fats have cholesterol in them. And then your body really needs it to be able to work properly. And having too much cholesterol in your blood will, potentially raise your risk for coronary artery disease or cardiovascular disease. But there have been some recent studies that say that cholesterol is just an indicator and that it gets the blame for the risk factors of coronary artery disease. And really, it's more about the narrowing that happens. So there's some more research that's coming out that I think is going to help clarify this for us. But what we know about cholesterol is definitely changing, and that's a good thing. So types of cholesterol, like I mentioned, the HDL, the LDL, and the triglycerides. The H actually stands for high density lipoproteins, and the L actually stands for low density lipoproteins. So those are things important to note. Hopefully, I'm not getting too medical, but I really want y'all to understand how all of this works together. So you've got the liver here, and it's making LDL, and it's carrying cholesterol to the cells. And then you see that represented here, that when you have an issue, like I mentioned earlier, where the blood vessel actually has some damage and it gets the inflammatory response signaling, hey, send some cholesterol here, it goes there and it forms what's called a plaque. So when you have too much cholesterol that's getting sticky and it's producing or bringing more to the site, maybe there's damage right here, and it starts to build up, then what happens is you have to have HDL to remove the excess cholesterol. And what we see a lot of times is that our LDL will be really high, meaning we have a lot of available cholesterol in the blood that's been produced by the liver or consumed. It goes to fix the area, but we're still having all this inflammatory response that's created from the smoking, the alcohol, the processed foods, the over exercise, the under exercise, the lack of sleep. So it keeps sending the cholesterol there, and we've got to have HDL to be able to remove that excess cholesterol. And so I think of it as like Pac-Man. The HDL has got to gobble up that extra cholesterol and take it back to the liver to be recycled. And so if we don't have enough HDL to do that, then it gets left in the bloodstream to deposit and form plaques. And those plaques are the things that can rupture. And it's described as a zit popping. And so when that zit pops or that plaque pops in the vessel, there's a risk factor for damaging the vessel or rupturing that vessel. And that's when you can have a heart attack if it's in the heart, or that's when you can have a stroke if it's in the brain. I hope that makes sense. So heart attacks and strokes are really the same thing. There's different causes, but when we think about cardiovascularly what's happening, it's really just about where it's happening in the body, whether it's the heart versus the brain. And then there are other types of heart attacks and strokes, certainly. So I hope that helps kind of understand, okay, where are we going with this? So what do we need to do? Our HDL and our LDL ratio of how many helpers to how many, cholesterol deposits that we have need to have a high HDL so that we have enough helpers. And I think that of the H as being a helper, we have enough helpers to gobble up the extra LDL. And so when we have really high LDL, we oftentimes have really low HDL. And that is, often more important than what our total cholesterol is, because we need to know if we have enough HDL. Sometimes our total cholesterol can be high because we just have really good HDL levels, and our LDL is actually within normal limits. And so you want to look at HDL, LDL, and triglycerides and not just the total cholesterol to get a better picture of where your heart health is. So triglycerides, like I said, are a type of fat that gets stored, and these are things that you need to pay attention to. So there are calories in what you eat. Extra calories, especially fat, gets stored in our body for use later. And part of that is a survival mechanism, right? We've got to be able to have some fat that we can reserve in case we miss a meal, or in case, in prehistoric days, there might have been, famines or things, and we couldn't get the foods that we needed because we didn't grow our foods year round. Foods were seasonal. And so our body's mechanism of storing fat is actually our body's way of surviving. So especially when I first started my weight loss journey, I would remember thinking and trying to be grateful for my body was built to survive because it stores fat really well. And so instead of being mad at my body for storing fat really well, I had to kind of shift my frame of reference and say, you know what, I would have survived during a famine because my body would have had extra fat on board and I would have been okay. And so that's something to think about. It's kind of a silly way to reframe, but when you're struggling with your health, you have to find the little things to be grateful for. And so you've got to figure out, what your body needs to be able to lose some of that extra fat. Again, reducing inflammation, drinking enough water, getting enough sleep, reducing stress, giving your body, a safe way to lose weight. Your body has to feel safe in order to lose weight. If you're stressed, your body doesn't feel safe at a physiological level. It's not going to lose weight because it thinks it's in famine, or it thinks that it's in danger, and it needs those extra calories. It needs that extra fat store. And so you've got to take care of your body. You can't really hate yourself to being thinner or healthier. You also can't deprive yourself to being thinner or healthier. There are really those kind of key things that your body needs to feel safe, love, belonging, feeling like you're going to feed your body, giving it rest, giving it hydration, giving it nutritious foods. Those are things that are going to help your body feel like, okay, I can lose a few extra pounds. He or she's going to feed me, and I'm good. So when your body does need the extra energy, maybe you're intermittent fasting. This is why intermittent fasting works for some people. It's because they get into the right state. They deprive their body of consuming nutrients and energy. And so then the body says, okay, well, if they're going to work today, they've got to have some energy. So I'm going to release some of those fat stores. And that's how that works. And so that is not a plug for intermittent fasting, because intermittent fasting does not work for everyone. It's not healthy for everyone. It works really well for my body at certain times. And so that's something that, we know works for a good number of people, but it's not always the healthiest version for people. So you've got to do what your body wants and needs. Your triglyceride normal value range. So we want the triglycerides to be less than 150. If it's between 150 and 199, it's borderline high. If it's between 200 and 499, it's very high, or it's high. And then over 500, it's very high. And I would say you're going to hear that it's very high if it's over 200. But this is the distinction here. But your provider, if it's over 200, they're going to be talking to you about lifestyle changes and medication, because that is very high and concerning once it gets to be 200 and 300. That's really increasing your risk for metabolic syndrome, and it's increasing your risk for heart disease once you get even just over 150. So the types of fats, you've got trans fat, unsaturated fats, and saturated fats. A lot of times when we look at a nutrition label, we only really look at the calories. That's what we've been conditioned to do, if we even look at that. And so I want you to start looking at the trans fats, the unsaturated fat, and the saturated fats. With trans fat, it's naturally occurring in artificial food preservatives, in fried, baked, and processed foods, and that will trigger your liver to make excess cholesterol. So look to see if you have trans fats on those nutrition labels. If so, try to look for them to be low or zero, because that's going to cause an inflammatory response for most people. Unsaturated fats are considered the healthier fats, so things that are like salmon, avocado, almonds, walnuts, olive oil, flaxseed, and even butter. So butter gets a bad rap, for being unhealthy, and there have been a lot of butter substitutes. I'm always a fan of using the naturally occurring thing in moderation versus using something that has been made by a human. So you're not going to see me use margarine. I'm going to use butter, and I use butter liberally. But you want to make sure that you make a choice that's healthy for you. And margarine and other butter substitutes usually are not going to be the best for your body. And saturated fats, things like animal fats and full fat, dairy, those are going to be things that can trigger excess cholesterol. But again, for most people, unless you have a particular, condition that says otherwise, need some of that good protein and fat, and need full fat dairy on some level. And certainly there are other alternatives for people who have dietary restrictions, either because of ethical or religious beliefs, or perhaps just because, they've made that choice. Maybe they feel better on a vegan or vegetarian or flexitarian or pescatarian diet. And certainly there are many others. And so just take what resonates with you. I know I can't address everyone's concerns on this call, but take what resonates with you and just hopefully use this as a launching point for you to do some more research on your own. So this is a graphic that I think really helps you see the ratio of total cholesterol. So it's the LDL, and you see how they have it on this graphic, the bad cholesterol versus the good. But you have LDL plus HDL plus your triglycerides divided by 5, and that gets your total cholesterol. So that's the formula. And that's why it's so important that you get the holistic picture there, because you could be having issues in, LDL, but your HDL is great. Or you could have a low LDL, but a really high HDL, which is always a good thing to have high HDLs, a lot of helpers around, and it puts you over that 200 level cholesterol, but it's because you've just got a lot of extra HDL on board. It's sometimes really hard for us to raise HDL if it's naturally low. There are some, environmental and genetic components to that. So sometimes people have to work extra hard by getting omega-3s, maybe supplementation, maybe extra fish that has omega-3s. It may be the flaxseed oil, it may be other supplements, because sometimes your body just needs a little extra help there. So I wanted y'all to be aware of that calculation, because again, it's so important that you get the big picture. A lipid profile is usually going to have things like your cholesterol range, your LDL, your HDL, and your triglycerides. So when they order a lipid profile, that's the formula and that's the level values that they're looking at. And so again, this is another great reference point that does it by gender. And usually we don't see it done by age, but we know that children are more and more likely to be obese or overweight, and that we're seeing children who have high cholesterol now. And so that is something to be mindful of as we look at children's diets, that, they're not immune just because they're young. They're also not just little adults, so their body processes things differently. And we have to think of them in that way, that they may need extra support. And certainly we don't want to be feeding them a lot of processed foods. And that's something that you want to consider if you have children in your life. So the downside of the excess cholesterol, we've already mentioned about how it can accumulate and form those plaques. And the accumulation can narrow those arteries, and that makes the arteries or vessels themselves less flexible. Again, think about that hose pipe that gets, hardened and brittle because of the rust. The cholesterol can act like rust in our vessels in that way. And so you can have high cholesterol that leads to atherosclerosis, that can lead to heart disease, that can lead to heart attack or stroke. And oftentimes high cholesterol really have no symptoms. So we talk about blood pressure as being the silent killer. And what I would like to see us do is change the narrative around that, because high cholesterol and high blood pressure, I have had both. And you can have symptoms with high blood pressure. You're going to start to feel tired. You're going to start to, when it gets really high, like stroke level ranges, which I suffered from that starting in 2018, you can get headaches and blurry vision, and your eyes can get really dry, and you can just feel really tired and fatigued, almost like you're recovering from the flu. And you just, can even feel really achy, but really having that headache and eye pain can be an early sign that your pressures are high. So there are symptoms of high blood pressure, but they're really typically not symptoms of high cholesterol. And what happens is you go to the provider, maybe you go to the wellbeing clinic, and they say, oh, you have high blood pressure. Let's look at your lab values. And then they usually will say something along the lines of, oh, and that's funny, your cholesterol is also high. Well, now you know that it's not like ironic funny that your cholesterol is also high. It's likely that it's high because you have high cholesterol, because you're narrowing those arteries and the blood's having to pump harder to get through. And so it's often that the high blood pressure is found first, but the high cholesterol is what was the underlying issue that happened before. And it's just that we often don't catch the high cholesterol first. We catch the high blood pressure first. And so I think that that's super important for us to recognize, because yes, you can have high blood pressure without having high cholesterol, but a lot of times when we're thinking about heart health, those two things go hand in hand, and it's not a coincidence. So cardiovascular health, again, we're concerned about heart attack and stroke, but also poor circulation, and high blood pressure is going to, really play a factor in that. So you've got the normal artery here, and this is looking at just kind of a cross section of the vessel. This is the initial stage of atherosclerosis, or that excess cholesterol. This is significant version of it. And then this is the last stage. And I want you to notice that when they say that there's a complete blockage of this plaque, the complete blockage is not 100% occlusion. It's closer to like 80% occlusion. And so when you have a complete blockage, where you're actually having a lot of signs and symptoms of, maybe chest pain or angina, or, you're short of breath and you're having symptoms, you're not even at a 100% blockage. You're at more like a 70 to 80% blockage, and that is considered complete because you have so many symptoms. So that is an important piece that, again, I don't think we talk about nearly enough. So inflammation, when high levels of cholesterol occur in the bloodstream, and you've got that excess LDL and it starts to seep into the blood vessel, it triggers that inflammatory response, and then that inflammation continues to cycle. And so you see here these little, blood cells that are trying to, depict blood flow through the vessel are having to go up and around this cholesterol deposit or plaque, which is sticky, and they can sometimes get stuck. And that's what can lead to things like blood clots or a rupture of the vessel. So these are some warning signs of clogged arteries. They can occur anywhere. So anything from actually having the stroke to having fatigue and dizziness, shortness of breath, chest pain, lower back pain. You can have pain anywhere in the body. So even like in the backs of the calves, that's a common spot to have a blood clot. Erectile dysfunction for gentlemen. And then painful or numb or cold hands and feet and legs. So our limbs can get very cold or painful. So these are some warning signs of clogged arteries. Again, they are shared through other disease processes, things like neuropathy. If you have diabetes, we can think that, that's what it is. So there are a lot of times where we can just say, oh, it's probably not this, but if you continue to have signs, if you have high cholesterol, this is something to really be aware of because it could be a medical emergency. And then the blood pressure, we've talked about it, but just to emphasize, it's that pressure that you have to exert to get the blood through the body. And so it goes up usually because there's something that's causing a blockage, and it sometimes is cholesterol, not always. Sometimes our blood pressure can increase because of hormonal issues. Maybe it's from stress. So if you were on your way to work this morning and you narrowly missed hitting the car in front of you and your blood pressure went up, obviously that's probably not from cholesterol. That could play a role, but it's more of the hormonal cascade that happens when you are having a stress response. And so your blood pressure can go up for that reason. So I just want to be clear about that. Cholesterol is not the only reason for high blood pressure, but it is an important component. And so then you have things like systolic and diastolic pressure. And it talks about when you have, normal blood pressure versus pre-hypertension, and you start to see the narrowing there. And then hypertension is where, again, it's not completely narrowed, but it's significantly blocked. And you can see that again here in a blood vessel depicted. Again, just another way to look at that. I think visuals often help us understand what's going on in the body. So hypertension are going to be, done in stages. So normal is less than 120/80. We used to say 120/80 was the normal, but now we want to see that it's slightly less than that. Then you've got elevated blood pressure, stage 1, stage 2, and then hypertensive crisis. And when I started having high blood pressure, mine was not caught until I was in hypertensive crisis, and I actually was over 180. Thankfully, my diastolic pressure was not that high, but it was over 100. And so I was having what was considered stroke level high blood pressure. And I'm happy to report I was able to wean off my medications over time. And now I have in the normal to low normal blood pressure again. And so I just want to offer that as there is hope that once you start having high blood pressure, once you start having, issues with overweight or obesity, you can still reverse that. So it's not a life sentence. It's something that you can work on. It took me 4 years, so it was not quick and it was not easy, but it was doable. And so I hope that's encouraging to you. Some recommendations for what you can do if you do start to have high blood pressure. And again, we're going to share this presentation with you. So this is just a reference for you. And then symptoms of hypertension. So we say it's the silent killer, but look at all of these symptoms that you can have: headache, shortness of breath, nosebleeds, flushing, so your face gets really red, dizziness, chest pain, irregular heartbeat, pounding in your chest, neck, or ears, visual changes. So usually that means your vision gets blurry, but you might have a normal eye exam. It's about the pressure, not about your eyes. You can have blood in the urine or even fatigue or confusion. And thanks, Miranda, for popping that in the chat. And yes, thanks for the congrats on the high blood pressure meds. That was quite a celebratory moment for me. And then hypertension diagnosis, blood pressure fluctuates. So if you have 3 or more hypertensive readings, that is going to be what gets you the diagnosis. So I always tell my nursing students, anyone can have high blood pressure. I mean, if I were late this morning and I nearly missed hitting the car in front of me, I would have had high blood pressure today. But that doesn't mean that I have a diagnosis of hypertension. And so, again, we use hypertension and high blood pressure interchangeably, and we really need to make sure that we're clear in our wording, because everyone will have high blood pressure at some point. But having consistently high blood pressure readings, 3 or more in a doctor's office or provider's office, is going to get you that diagnosis of hypertension. So just think about it. If you only go for a yearly visit, it could take you up to 3 years to get a diagnosis, and that we know is not acceptable. So if you have a high reading, make sure that you follow up with your provider. Make sure you follow up. You can go to one of our machines here on campus. We've got one at the student center in the stairwell on the first floor. There's also one at the HR building on our adjacent campus. And so, or any, grocery store or pharmacy usually will have a blood pressure machine that you can use. And that's a good way. If you get 3 readings in a row, you need to go back to your provider and say, this is still an issue for me. I need some help. And it may not be that you immediately go on medication. It may be that you do some lifestyle and diet changes first. So here are some effects of high blood pressure. Again, it can lead to sexual dysfunction, our heart issues, our brain issues, our vision issues, and kidney issues. And then the impact. We've got about 75 million Americans who have high blood pressure. So that's about 1 in 3 adults. And then 1 in 3 adults, in addition to that, have prehypertension. And so this is not an isolated issue. About half of all adult Americans with high blood pressure say that their condition's well controlled. So that means a little less than half are not considered well controlled. And that may be with medications, or it may not. And Miranda has just put the blood pressure kiosk on campus. She's linked that for us. Thank you, Miranda. So other risk factors, the ones I want to focus on, you can think about stress reduction, smoking, any kind of substance use. So that could be anything from illicit drugs to caffeine. Obesity, diabetes, salt intake. So, it's important that you get iodine, but table salt is not the best option. Things like, Celtic sea salt would be a better option. Maybe even some Himalayan pink salt. Those can be better options for you. Overly processed foods are going to be, a challenge because of that inflammatory response. Caffeine, because it causes inflammation. And then lifestyle factors beyond that. So having a sedentary lifestyle, or having, pollution or things. The things you can't really control, you can't control your family history or your genetics. You can't control your ethnicity or your age or your sex. And so those are going to be things that are just things that you have to be aware of that you can't control, but you can control what you can control by doing these lifestyle modifications. And then there are medication options. Again, they usually try to put you on a diuretic. Hypertension medications typically are going to be lisinopril and hydrochlorothiazide to start with. But we know that those don't all work equally, especially for African Americans or sometimes women. They don't respond well to those, but those are going to be kind of the first line medications that people prescribe to you. And then just know that diabetes compounds that problem, because then if you have too much sugar also circulating in the blood, in addition to all of that cholesterol that's in the blood, then you just have a really, really sticky situation. I've seen several, videos online of things like Instagram, dietitians putting honey in a cup in a straw and trying to drink the honey through the straw versus drinking water through the straw. And that's to simulate how much sugar gets sticky and starts to build up. If you've got diabetes and then you add in cholesterol, that can make it a hospitable environment for having a lot of issues in your vessels. So metabolic syndrome, I mentioned earlier, is the high blood sugar, high blood pressure, high cholesterol, and low LDL or low HDL, excuse me, high triglycerides, and then that excess fat around the waist. And so if you have those things, you're going to be more at risk for these chronic health conditions related to your cardiovascular health. So a holistic approach to health, and this is really a menu. This is why I want y'all to have this set of slides, because we've talked a lot about the problem, more than I typically do, because I think that we overlook the problem, the real issues at hand. And so I usually spend most of my presentations in other areas on the actual solutions. But I needed y'all to know more of the why behind why some of this is happening to you. And then you'll know what to do to be healthy. Control what you can control. I always include this because a lot of things are out of our control and we don't want to get overwhelmed or bogged down by that. So this last diagram, the Venn diagram, is where things that matter are within your control, where those overlap, that's where you should focus your time and attention. And then just move through this toolkit of resources until you get the right balance for you. So try things out. If it doesn't work, try something else. That's how I approached my, health and wellness journey about 3 to 4 years ago. And really my health had been deteriorating, but the real, kind of catalyst for change was going to my doctor with a stroke level high blood pressure in the fall of 2018, about this time of year, and leaving with a prescription for hydrochlorothiazide. That was kind of my, aha moment of I need to make some changes. And everyone has those, but that was mine. So here are some 7 steps to a healthier start. It's eating a healthy, balanced diet. It's getting active. It's making sure you know what your blood sugars are, because your blood sugars fluctuate. So just having a spot check at a doctor's office or wellness fair once a year is really not enough to understand how your blood sugar is responding. A lot of people have insulin resistance, and so that's important to be mindful of. Knowing your numbers in terms of your cholesterol, your BMI, your waist circumference, your overall weight, monitoring your blood pressure, and then again, avoiding illicit drugs and nicotine and caffeine can all be really helpful. We have a talk on wellness basics. I included this slide. If you are trying to make changes, if you're not sleeping well, if you're not staying hydrated, if you're not eating a healthy, plate, meaning that you're getting a lot of good fruits and vegetables, that you're eating the rainbow, if you're not moving your body every day, if you're not meditating or resting throughout the day, then it's going to be hard for you to tackle things like high blood pressure, high cholesterol, weight, all of those things if you're not doing the wellness basics. So I always tell people, and that's why I have the GPS, start here, because that's truly where you're going to start to see some change. And then I have some slides on, well, what does it mean to sleep well? How do we do that? It's not just about the number of hours you get, but it's the quality of sleep you get. So if you get 8 hours of sleep a night, that's great. But if you wake up the next day feeling as tired or more tired than you when you went to sleep, that's not going to be quality sleep that's really helpful or restorative. So some things to try here. Some different ways to make sure that you're staying hydrated. We say to drink about half of your body weight in ounces a day, which tends to be about 4 to 6 ounces of water per hour while awake, to be around 100 ounces or so, usually not more than 128 ounces. There are some exceptions to that where they'll tell you to drink more water. I've had kidney stones recently, and so they're actually telling me to drink about 150 ounces of water a day. But again, that's under a healthcare provider's order. That's not something that you recommend normally. So just giving you that as an example of an exception. But you can overhydrate. So if your urine color is clear or very, very, very pale yellow, then you're probably overhydrating and you might be flushing out a lot of good electrolytes and minerals. So you don't want your urine to be clear. You want it to be a pale yellow color, like a straw pale yellow color. Make sure you always have your water bottle with you. It makes it so much easier to drink it when you have it. And nourish your body. When I say eat the rainbow, I mean don't just eat green and beige food, but eat colorful foods, because each color represents different antioxidants and minerals and vitamins that you're not going to get if you always skip the orange category or you never get any purples in. You want to make sure that you have a protein, a complex carbohydrate, and a healthy fat at every meal. That's going to help you balance your blood sugar. And keep track of when and where and how you eat and what you eat, because a lot of times we think that we're drinking a lot of water, we're eating healthy foods, but when we start to track it, we realize, oh, I'm not eating as healthy as I thought, or I'm not drinking as much water as I thought. So, and just know that your appetite and your hydration needs are going to change every day. So what works today may need to be adjusted tomorrow. And then make sure that you don't, kind of backtrack on your good progress all week. That was something early on that I had to recognize, is that even taking the weekend off, those 2 days mattered in terms of my health and wellness. And so I would kind of undo all of the good things that I had done during the week on the weekend. And so try not to take the weekend off of your health and wellness goals. That'll make a huge difference. Consistency is going to get you so much further across the finish line than perfection will. So especially if perfection is sporadic and inconsistent. Move your body every day. Make it simple, make it easy, make it free, make it fun. So just walk. Start with walking. Meditation, that might be traditional meditation, or that might be closing your eyes. It might be listening to music. It might be getting outside. It might just be resting for 5 minutes. But try to do that a couple of times a day. Work up to 15 minutes 3 times a day, morning, afternoon, and evening. Try to laugh every day. Be present where your feet are. Be mindful of distractions, and just let your brain rest. We're not designed to hit the snooze button, get up for the day, and go until we go to bed at night. That's why we don't sleep well, because our bodies just aren't designed to be like a light switch. Mindset matters. So this is the GLAD technique. Try to practice this every day. It's not about, oh, I have to list 3 things I'm grateful for every day. Don't make it a chore. Gratitude, when it becomes a chore, it really negates the principle of it and the benefit. So one thing that you're thankful for today, one thing that you learned today, hopefully you learned a lot of good stuff on this call, one thing that you accomplished today, and then one thing that delighted you today. So that's the GLAD technique. Try to practice that as much as you can. But again, when it feels like a chore, take a break, because you want to make sure that you stay really mindful with this. But this is a gratitude practice that can make a huge difference in our mindset, and it can impact our health. Here are some practical tips. Again, you have this, so we don't want to go through every point, but just know that a community of support is going to be really helpful as you start to make changes, and stay encouraged, because your progress is not linear. You don't just go from point A to point B and cross the finish line. Unfortunately, there's usually a lot of struggle involved and a lot of trial and error, and that is okay, because you learn so much about yourself in that process. Talking about smoking, vaping, and tobacco use, you want to try to avoid it, limit it, and make healthier choices. Exercise, some things that you can do for heart health. Again, these are the recommendations specifically for cardiovascular health, and about 30 minutes 3 to 5 times a week is going to be what most people recommend. And you can do some cardio, like high intensity interval training, if you are in the condition to do that. You don't want to go from not doing anything to doing high intensity interval workouts 5 times a week. That's going to put a lot of stress on your body. Again, talking about body mass index, losing just 10% of your body weight can make a huge impact on your overall health. And then just some more information there. This is just a guideline. Again, there are a lot of flaws with this, but it is a metric that can help you. The DASH diet is always important to talk about. Again, I would say limit the things like margarine or sugar substitutes or salt alternatives, and just lower your consumption of those things. But the DASH diet is dietary approaches to stop hypertension. And you want to just make sure that you are looking out for those added salts and sugars in your diet that you may not realize are there, like ketchup, for example. Here's where you find the trans fat label and the saturated fat. And you can do some math from the total fat to figure out what your unsaturated fats are. Usually those are not listed separately. And I know we're coming up on our time. I have just a few more slides I want to get through, but y'all are welcome to go at any time and you'll get your full credit. Here's another food label here that gives you more information. I think it's so important to understand how to read a food label. It seems really simple until you start looking at, what does all of this mean? And so this is a way for you to, teach others and to be more mindful. Don't just look at the calories and the serving size to figure out, okay, is this a good choice? But really look at the entire nutrition label. These are some things that you can try to limit inflammation. Turmeric, or you'll hear people say turmeric, omega-3s, more fiber, especially, plant-based fiber options, more fruits and vegetables and healthy fats. and try to limit your sugar, your refined carbs, your alcohol consumption, your meat, your processed foods, and your trans fats. Thank you, Andrea. How stress affects the body. We all know that stress can be harmful, but there's a TED Talk called How to Make Stress Your Friend, and that helps reframe stress because, like cholesterol, stress is necessary. Stress keeps us from being bored. Stress keeps us from being unprepared. So stress is needed, but we need to be able to manage it well. And so that's a good TED Talk, How to Make Stress Your Friend. And then just a few more things. Start where you are, use what you have, and do what you can. That's a quote by Arthur Ashe. And I truly believe in just take what works, try what you can, control what you can control. And every day is a new day. Don't wait until, next week, next year, the new year to make changes. Every time you get off track with the next choice, just get right back on track, and that consistency will pay off. This is our social media. Miranda and Ashley and Carolyn do an amazing job, a phenomenal job of maintaining all of this, and they are the Wellness Work Life team. So follow us there. You can reach out here if y'all have any questions or anything that you need, and I'll be happy to take any questions or comments or feedback. I know that was a lot of information. And thanks to everyone who's already commented in the chat. Thank you, Colleen. Thanks, Michelle. Thanks, Elizabeth. Thanks, Matthew. Y'all have a great day too. Yes, I love the no bad foods, good foods. Yes. I have had 2 chocolate chip cookies this week, and I made them at home so they'd be a healthier option, and I loved every minute of my chocolate chip cookie. No guilt whatsoever. I just made a healthier choice by making them at home without enriched flour. So, and with fresh farm eggs. So glad y'all enjoyed it. Any other questions, comments? I'm going to go back to the other slide so y'all can get my information if you need to reach out. All right. Well, seeing none, I'll go ahead and say goodbye for today. I hope y'all have a great rest of your weekend. Roll Tide. If I can be of any help, please do reach out. And I hope this inspires you to just make one small change. For me, it was a 4 to 5 year journey, and there were a lot of moments where I wanted to give up. But on the other side of it, I'm not done. A health and wellness journey is never really done. You learn that, I think, somewhere along the way. But I'm so glad to be on the other side of it, and to know that there is hope for reaching your goals, even when it feels like there's not a lot of resources out there. So happy to answer any questions, but I hope you'll have a great rest of your day. Roll Tide.